Hello, everybody. Thank you for having me, Rotary Boronia. So, as Ron was introducing me, I'm Dr. Avi Charlton, and I'm actually a GP for 20 years. I've been a doctor for 25, and we're actually having a gathering in November to celebrate 25 years. We finished in medical school year 2000 in Melbourne Uni. So the talk is how to create vibrant health. So just get a raise of hands who wants vibrant health. That's everybody. Everybody wants vibrant health. So, but sometimes this is very common. You feel tired. Some of the ladies might feel a bit hormonal, aches and pains, overweight. This is really common. This happens to a lot of my patients. I'm just going to tell you a bit about my journey on how I got here. So about 10 years ago, I had young kids. My kids are now teenagers. They were 6 and 3. So I wanted to lose some baby fat. I joined the local gym because one day what happened was a patient came in and she was, we're doing just a prescription, just a normal prescription. She said, "Oh, are you having a third baby?" And I thought, oh my God, I'm not having a third baby. 2 was enough. I just had 2 boys and that's enough. So I was devastated. Wanted to crawl in the hole. So I was determined that I'm going to lose weight. So I joined the local gym and I got prescribed a diet on a spreadsheet. So I had to put 120 grams of protein, 20 grams of carbs, 20 grams of fat onto a plate and weigh it. After 8 weeks, I lost a bit of fat and I felt much better. So I looked into this diet and of course I exercised as well because this is prescribed by the gym. So after 8 weeks, I lost 4 kilos, 4% body fat, and I felt much better. So I started to look into this journey. It's a low carb diet, and just a bit of an idea on what I do. So I have 2 kids and 2 dogs, and I have a farm out in the Gerties. So if you know, on the way to Phillip Island, we have a farm. And this is Wantirna Mall Clinic, just up the road. So I've been practicing Wantirna Mall Clinic for 20 years. 3 years ago, I set up Melbourne Low Carb Clinic because I feel like patients need to be heard. So I promote 45-minute consultations rather than 10 minutes in and out. Patients do have to pay because paying actually is investing in your own health rather than bulk billing. I'm still bulk billing some days, but I'm really weaning down on the bulk billing clinic. And I set up a low carb group called Low Carb Melbourne on Facebook. So this is just me in a nutshell. I did lots more training other than just normal GP work. So I did some obesity training. I joined Low Carb Down Under and did some courses. And I become a metabolic health practitioner. And I also did some breath work because doing breath work is so amazing for stress management. And also did Nutrition Network online learning because during COVID, I had extra time. So this is my extra learning. And just to cover myself, this is not formal medical advice. If you want medical advice, you're most welcome to come and see me in Wantirna, just down the road, less than a kilometre away. So I'm going to ask you, who wants to live long? Who wants to live healthy and long? So there's actually quite a discrepancy in our population. The average lifespan, we are living quite long. The average lifespan in our population is 79 years. So we're living quite long, but the health span is only 63 years. So this is according to the statistics, which means 16 years on average, people live in chronic diseases. So imagine 16 years of aches and pains and diabetes, heart disease, getting prescriptions every 2 weeks, coming to see me, and obesity, diabetes. So this is what we're dealing with in the population. A lot of people have poor health for 16 years. And these are the chronic conditions according to the statistics. And in fact, 42% of the population has at least one chronic condition. So half of you have at least one chronic condition. And these are the chronic conditions that people suffer from: back pain, asthma, diabetes, heart attacks, osteoporosis, airways disease, cancer, kidney disease. So half of you have one or more of these chronic conditions. A lot of these chronic conditions can be prevented by lifestyle, eating better, and even reversed. So we can reverse these conditions and actually come off medications and reduce medications. This is my framework for prescribing lifestyle. So I like to talk about prescribing lifestyle on top of prescribing medications. A lot of GPs, you go into the GP and high blood pressure, here you go, here's a blood pressure tablet. If you have a cold, here you go, here's an antibiotic. If you have depression, there's an antidepressant. I like to get you to have a look into your lifestyle. How is your eating? So if you have diabetes, you can't eat sugar and carbohydrates. You're carbohydrate intolerant. So I like to challenge you. Is there something you can do with your lifestyle other than I give you medications? Can we try to reduce the sugar and the processed foods before I give you a blood pressure tablet? So this is what I like to think about. And maybe you have a bit of stress and anxiety. Can we talk about stress management rather than giving you an antidepressant? So we're going to talk about how we can look at lifestyle in each of them. So first of all, because this journey, I prioritize my nutrition. A lot of people think nutrition is just eating foods. Lots of doctors aren't taught on nutrition. They just give medications and not really talk about nutrition. So in the modern society, 85% of people aren't eating right and have chronic conditions and are insulin resistant. So I will talk about it. But looking into nutrition and looking at what you're eating is so important. There's mums that are busy that just get takeaways. There's chips, there's processed foods, there's big foods trying to advertise on sugar, processed foods. And there's lots of people trying to advertise, you just have to eat less, move more. And to tell you the truth, eating less, moving more doesn't work, because eating less, you'll just be hungry. And moving more, you get even hungrier. So the smaller portion will get you starving, and it doesn't work. It will help you lose weight in the short term, but ultimately it will affect your mental health. You'll reduce your metabolism, and you'll just put more weight back on when you eat normally. So I don't believe in calorie in, calorie out. And then there's all these medications. This is an old slide. Now there's Ozempic, there's Wegovy, there's Mounjaro, and there's more and more injections. These injections, half of the parliament are on these injections. So everyone's on these injections. The problem with these injections is you lose your fat, but you also lose muscle and bones. And 40% of the weight that you lose are muscle and bones. And if you lose muscle and bones, you become frail and you become easy to break if you fall, and become weak because you won't be able to lift because you're losing muscles. Most of these drugs are actually gone. Xenical Reductil is a weight loss drug that's banned and off license because it causes people to have mental disorders. Duramine is speed, and most doctors don't like to prescribe. You can cut a bit of your stomach out with bariatric surgery, not reversible, and nutrient deficiency. Ozempic is heavily prescribed because people want quick fixes. OptiSlim is a calorie restriction that is highly inflammatory, doesn't treat the root cause. So I'm going to tell you how you can eat better. rather than calorie in, calorie out. We want to prioritize our nutrition, eat good foods to nourish your body. So first think of the protein. So the lamb shanks is amazing. It's so yummy. So first think, when you plan a meal, think what protein you're going to eat. Meat, eggs, chicken, fish, and if you're a vegetarian, tofu, lentils, legumes, because that's where the nutrient is. Healthy fats, because the fat's been demonized for so long. Low fat diet doesn't work because our body needs to have essential fatty acids. So bring back the butter, don't go to margarine. Avocado, nuts and seeds, dairy is fine, cheese is healthy fats, peanut butter, that's all good fats, olive oil is great. There are really unhealthy fats like trans fat that people use to deep fry. The KFC, the chips are all unhealthy fats. It's canola oil, vegetable oil. Please stay away from all those. That can increase your risk of more chronic conditions. And understand your carb tolerance and only eat good carbs. So I promote low carb. I'm not saying everybody needs to eat low carb, and it depends on how your metabolism is. Because if you can tolerate carbs, then sure, eat the carbs, but it'll be great to eat the good carbs, like real food, pumpkin, potato, fruit. They are good carbs. But it depends on what your health is. If you've got health conditions like diabetes, obesity, your carbs might not be your friend. What are carbs? So carbs is your bread, potato, pasta, sugar, grains, biscuits, cakes, even fruit is carbs as well. So it depends on what you want out of your health. If you want good energy, if you want to lose weight, if you can't have a lot of carbs, then maybe they're not great. And you have to understand our body can only hold 4 grams of glucose at a time. Excess glucose, more than 1 teaspoon. So 4 grams is 1 teaspoon. More than 1 teaspoon, your body has to make this insulin, is the hormone, to ship it away. So this insulin hormone your body produces to put your glucose away. The more glucose you eat, the more your body produces insulin. And if you make lots and lots of insulin, you become insulin resistant. So these are the signs of insulin resistant. So if you've got a belly fat, if you're tired, skin tags, high blood pressure, frequent infections, brain fog, hungry all the time, they are signs of insulin resistance. Then you might want to reduce the insulin, because if you keep eating sugar, your insulin will keep stimulating. And I can actually test insulin. A lot of doctors don't test insulin because they just test your diabetes, and if you don't have diabetes, end of story, you're fine. But I organize a blood test called fasting insulin, which I really doubt your doctor will test. So in a routine blood test, I can organize fasting insulin and see how tolerant you are to carbohydrates. A lot of doctors just look at HbA1c. Hemoglobin A1c is your average blood glucose over a 3-month period. And they say if you're under 6.5, you're fine. You can do whatever you want and retest in a year. But I think if you're between 5.7 to 6.5 and your insulin is high, here is a warning sign that you can reverse it. You don't have to become a diabetic by eating the right foods to fuel your body and let your body heal. You can lose weight. And insulin resistance is linked to so many chronic conditions like diabetes, Alzheimer's disease, even cancer, mental health conditions. Young girls can get polycystic ovarian syndrome, ADHD, schizophrenia, depression. So there's so many conditions that are linked to insulin resistance. And again, you can prevent yourself from getting diabetes and Alzheimer's disease and cancer. So what is low carb? So low carb is less than 50 grams of carbs a day. Ketogenic is less than 20. So I'm not saying everybody needs to do low carb or keto, but you need to understand The standard diet is 200 to 300 grams of carbs a day. So a standard diet, if you eat cereal or toast for breakfast, sandwich for lunch, maybe a pasta for dinner, that is like 200 grams. And remember, your body can only hold 4 grams at a time. So it is a lot of glucose your body has to work through. And we eat frequently with snacks, muesli bars, fruit as an afternoon tea, or biscuits, muffins in between meals, then your insulin is stimulated all the time. Again, this is the causes of insulin resistance. In the modern lifestyle, everyone's sedentary, we're not exercising enough, we're eating too much carbs, too frequent, causing all these things like heart disease, polycystic ovarian syndrome, arthritis, Alzheimer's, diabetes, high blood pressure, osteoporosis, cancers, inflammation like aches and pains. So we can improve this just by eating better rather than tablets. So just to wind up with nutrition tips is prioritize your nutrition. So think about how you can improve your nutrition every day. Eat good foods to nourish your body, nourish your brain. Think protein first. Stop fearing fat. We need good fats. So low fat diet is out the window. Know your carb tolerance. If you want to lose fat, if you want to have mental clarity, maybe you can't eat so much carbs. 85% of the population are not metabolically healthy. So 85% of the population can't eat so much carbs. Avoid seed oil like vegetable oil, canola oil, and avoid processed foods. You can do fasting. So who knows who said breakfast is the most important meal of the day? Who said breakfast is the most important meal of the day? Kellogg's. So Kellogg said breakfast is the most important meal of the day. So you actually don't eat breakfast. Nobody needs breakfast. Our body doesn't need to eat all the time. I don't eat breakfast. I walk out the door after dropping the kids off and I start my meal middle of the day, 12 o'clock. So they're trying to sell you breakfast cereals. And you can get blood tests to get to know your body, and I can test it. So that's about nutrition. And then we get to strength training. As you get older, it's important to build your muscle because your muscle peaks when you're 30. And every year you lose muscle unless you're building it. So it's important to lift weights and squats, and it doesn't have to be long, 15 minutes twice a week. That's all you need to build muscle. Lifting heavy weights would be great, but lifting any weights would be good. Even body weights is fine. So exercise, you can do it in a group. You can just go easy exercise. You can do pickleball, so many things. I've done lots of park runs in the last 10 years. There's a park run on Lewis Road. There's one on Mitcham. I go to Westerfolds in Templestowe because I live in Donvale. There's park runs everywhere. If you go down to Narre Warren, there's heaps of park runs. You don't have to run, you can walk the whole thing. When my 4-year-old was joining me to park run, he took 1 hour and 15 minutes to walk and whinging, and because he was 4. But 5 kilometers, you can walk the whole 5 kilometers in 1 hour. Very easy, and you get a code and it's all free. And this is what I prescribe to people. Get outside, go into the nature. This is Mount Dandenongs, and you get to look out, see these beautiful, just around the corner. And you go out to the mountains and you get all the good energy from the sunshine and the nature. Even if you just go into your backyard, grounding is a thing. You just have to get your shoes off and go walking in your own grass. And you can get the sunlight, vitamin D, then you can start building up your hormones. Most people have too much indoor time and not enough outside time. So there's the tips, is just get moving, schedule it in, have a partner, exercise with others, start small and build it up. So Very easy. The next tip I'm going to give you is sleep. We need to prioritize our sleep. Some people have poor sleeping habits. Some people want to scroll on the phone. My kids may be scrolling on the phone. And then if you want good sleep, getting outside first thing in the morning to get sunlight will be great to improve melatonin at night. So the sunlight and the circadian health is really important. So going to bed same time every night, waking up the same time every night, getting morning sunlight, reducing artificial lights at night, and grounding, like just barefoot in your own grass. So easy. Stress management is really important. So these are really easy and free. I do meditation every morning for 5 minutes and sometimes 30 on a weekend. That's my morning routine. Some people say, I can't do meditation, can't have my mind blank. But it doesn't matter. The practice is just bring your thoughts back. Breath work is just noticing your breathing, breathing through your nose. Don't breathe through your mouth. And even when you go exercise, breathe through your nose. And just paying attention can help you be mindful. Do some gratefulness, journaling, and that's part of stress management. I've even become a breathwork facilitator, learning how to breathe better. So I organized breathwork workshops last year, and I did, not last year, this year. I've done 3 breathwork workshops in Donvale and in Caulfield, and this is me facilitating people to breathe. And we do some quick breathing and slow breathing just to manage our stress and learning how to breathe better. So I'm just going to share with you what heart coherent breathing is. So what I'll get you to do is just pay attention, close your eyes, breathe through your nose, and we're going to start breathing in for 5 counts and out for 5 counts. Breathing in, 2, 3, 4, 5, and out. 2, 3, 4, 5. In, 2, 3, 4, 5, and out. 2, 3, 4, 5. In and out. So you can open your eyes and just pay attention if anything shifted in your body, if you feel a bit calmer. It's so easy just to breathe in for 5, out for 5. You can do it anytime. You can do it when you're driving. If you do it once a day is great. If you do it twice a day is amazing. If you do it 3 times a day, it's even better. 1 minute is amazing. 5 minutes is even better. And that's all you need. 5 minutes once a day, 2 times a day, or 3 times a day. Just pay attention to how you're breathing. Just slow down your breathing. Most people breathe too fast and breathe in for 5 and out for 5. Just slowing down breathing can make you aware of how your nervous system is. And there's actually so many other breathwork techniques that you can do. A lot of people know box breathing is breathe in for 4, hold for 4, out for 4, and out for 4, hold for 4. And then there's so many other things that you can learn about breath work. And then the next tip is building healthy relationships. And I'm so amazed the Rotary Club builds healthy relationships because you're all good friends and you meet every week, and it's great to have this to improve your vibrant health and make you connected with each other. So part of it is just having a community. Loneliness actually kills people. So I'm encouraging you to think about your lifestyle, to charge up your battery. Your body is actually a battery. We need to feed this little mitochondria. Mitochondria is a little thing in your cell to charge up, to provide energy. So we need to feed our body with good foods. We need sunlight. We need to have community. We need to charge ourselves up with good sleep. and exercise and stress management and relaxation. So everything you do, just think, is it charging your battery? So maybe the junk food and the sugars aren't really charging your battery. Maybe if you're not sleeping, staying up at night every night, that's not charging your battery. So think of all that so you can create vibrant health. And I might be overwhelming you to tell you to not eat the carbs, but you can just do small steps. You can just change your breakfast from a toast and cereal breakfast to an egg breakfast. And then you might feel much more satiated. Just change breakfast first, and then lunch and dinner, change it a bit later. You can start going for a walk, even if it's just 10 minutes. Just do one thing at a time, once a week. So one week, change one thing at a time. Again, just to reiterate, I've got 6 pillars of lifestyle that I practice. I wrote a book and I published it, and I'm here to sell it. So I decided in February this year that I'm going to write a book because I want to spread this word on lifestyle, and that's why I'm here to talk to you, because I want to be a speaker and spread this word that everyone can be empowered. We don't need blood pressure tablets and diabetes drugs. We can get off some of these drugs. And in fact, I tell people that if you go low carb, if you're an insulin type 2 diabetic, you can actually reduce the insulin and get off some of the medications. So I wrote this book and published it, and came out in August. And I had a book launch last month, actually, in Templestowe. I had a book launch party. So this, I also got Amazon bestseller. So I'm selling it for $25 if you're interested. You can also go on Amazon and download it on the Kindle for $9.90, or you can buy it from Amazon as well. But I've got a few copies. And this is an older one that has been passed around on my table. This one's $15. That's got some theory of some graphics that I wrote and some recipes. So you can buy either of these, and I won't be offended if nobody buys. And you can come and see me in Boronia Road, Wantirna. I don't take new patients in Wantirna Mall Clinic, but I take new patients in Melbourne Low Carb Clinic. And I've got some brochures that you can come and see me. And I also do telehealth. And thank you, Rotary Club, for having me. And I hope this inspires you to take charge of your health and lifestyle.